King County says it only has race and ethnicity data for 51% of its coronavirus cases. The public health crisis is shining a light on the trouble the state has when it comes to tracking this kind of information. Mapping and monitoring coronavirus cases. In King County, as of Friday, preliminary data showed Hispanics and Latinos making up 10% of the population, but more than 17% of confirmed coronavirus cases. The rate is also high among Native Hawaiians and Pacific Islanders.
It's important for us to know, is that happening and where, if at all possible.
Gordon McHenry Jr., president and CEO of United Way of King County, says it's the kind of data that helps his organization know where the greatest need is. But health officials in King County say the major challenge is that virtually all coronavirus case reports come through laboratory reporting systems that do not have information on the patient's race and ethnicity.
How concerning is it that the information is so incomplete?
Well, it is a concern because we know from a lot of different sources, King County Public Health being one of them, that we have significant race and ethnic disparities in King County.
He says for communities of color, that can mean limited access to health care and poor health.
There is a linkage to pre-existing conditions and living on low incomes or being in and out of states of poverty.
Factors having a big impact on this coronavirus fight. Should race and ethnicity data be required for all notifiable disease cases? That's something Public Health Seattle and King County says it supports, and it's something that Washington State Board of Health is reviewing. In Seattle, Natalie Swaby, King 5 News.